It's a Dr. Wilcox Thursday. Doc Wilcox is with us in the studio. Good morning, sir.
Good morning.
How are you?
I'm well.
You are touching on a subject today that is widespread. People probably know a lot of people that have glaucoma.
Yes, glaucoma is the painless thief of sight. If you had ulcers in your stomach, you're running to your doctor going, help me, my stomach hurts. And listeners here, I'm driving to work this morning or at home, some of them are going blind from glaucoma and they don't know it. And some of them are being treated for glaucoma or watched for glaucoma. It's painless. You classically you lose the sight in your right eye. You're going to lose your sight to your left in your nasal visual field, and your left eye you lose your sight to your right. So what happens is there's a crossover between your right visual field and your left visual field. So you don't know you're losing it because the other eye is covering for you. And so you lose your peripheral vision first, and it's horrible stuff. So you have to go to an eye doctor in almost all cases of diagnosing glaucoma because you don't know it. If you know you have it because you have field loss, you're on third base. Home run being the worst place to be. If you know you have it, you go, I'm having trouble seeing. You're in a peck of trouble. So it's something best caught early. It's like you're better off catching that fire when it's in the frying pan versus when it's in the kitchen or the first floor, and you're better off catching glaucoma early.
But isn't it, as you point out, it's kind of hard to know because one eye, picks up the weight of the other. But I always thought it just slowly diminishes the vision from the outside in, which is primarily what you're saying.
Yes, just what I said. But in most cases there's about 40, 50 different forms of glaucoma, and you have some. And so of the forms, the nerve fibers that you lose in the back of the eye as they exit the back of the eye and go to the brain affect the ones that cover your nasal visual field. And so that's, so yes,
define
sir.
Nasal visual field.
Okay, I'm looking at you with my right eye.
Right.
Okay, my left eye's closed.
I am too.
My nose is over here, so my nasal visual field is with my right eye looking at you is to my right, to my left. This is my nasal field. This is my temporal. This is superior. This is an inferior. So it's up, down, left, and right. So we call it, superior and inferior. Temporal by your, the temple, and nasal. So
if you close one eye and you've lost a little vision, is that a sign?
Yes, and if you're good enough at self-diagnosing by putting, your hands out equidistantly, sorry listeners, hit the mic, equidistantly to the side, you should be able to see if I'm, if I move them out 18 inches at arm's length, I should see both thumbs, but okay. So, any rate, and glaucoma doesn't hurt. I always talk in metaphors and similes and analogies because it's not my job to exercise my big long words. It's to make sure that when you leave, you know what's going on and how it applies to you. So glaucoma, I can kill you two ways. I can strangle you with my hands around your neck. That's pressure. Or I can loosely drape a plastic bag over your head.
Right. Either
Either way, you die. So what happens is, and sadly, in my opinion, very sadly, most eye doctors chase the strangle, the pressure. Oh, your pressures are fine, you're good to go. And when in fact, a lot of glaucoma loss is because of the plastic bag, of the poor oxygen, the poor perfusion. People with sleep apnea have a lot of glaucoma, low tension glaucoma, because they don't oxygenate their body well. When you don't oxygenate, and your eye is the biggest consumer of blood in the body per square unit volume.
You said that before. I find that amazing.
So there's more blood. The eye is so big. Your heart is bigger. Your leg is bigger. But you got the smallness in the eye and the amount of blood that goes through there in order for the cells to replicate for you to see, because there's constant turnover of cells in the eye. So there's a ton of oxygen and there's a ton of blood that's passing in the eye. And therefore, if you have a 10% problem that affects your whole body, it's going to affect your elbow a lot less, which doesn't get much blood, than it is your eye, which gets a lot of blood. Okay, it's just it's a math thing. It's ratios. So the fact is, people get glaucoma for lots of reasons. Usually, it's a plumbing problem. You make fluid in the front part of your eye, you get rid of it in the front part of your eye. It does not come out as tears. This is all inside the eyeball stuff. And you can get the drain that's in the front part of the eye called the trabecular meshwork, can get clogged up, can get narrow. That's one reason. If you think of your bathroom sink, you can turn your bathroom sink on just a little bit, but if you turn it on a lot, there's a whole lot more fluid coming out. So you could be making too much fluid. You could be not getting the fluid out quickly enough. That's mechanics, plumbing. You could have a problem with the structure of your eye. If you have 100 blacks in a room and 100 white people in a room, just to go to the extremes, the whites have macular degeneration by and far large, and more blacks have glaucoma because blacks tend to have thinner corneas. When you put a contact lens in your eye, you put it on your cornea.
Right.
Well, that cornea, the clear part of the eye and the white part of your eye are made of the exact same tissue. It's just they're woven together differly. Hold on, let me finish that thought.
Okay.
So not to offend anybody.
Okay.
And so if you have a thin cornea, then you have a thin white part of your eye. If you have a thin white part of your eye, the sclera, then you have a thin part of the eye where the optic nerve travels to the brain. And when that's thin and kind of flaccid, if you will, then the nerves and the blood supply to that area suffer, and then you suffer damage quicker, sooner, faster. My analogy I use, to use another one, is the three little pigs. You have a straw house, a stick house, and a brick house. And when the BBW, the big bad wolf, blew one time on the straw house, he destroyed it. And then the stick house a few times, and the brick house, he can never blow it down. So if your eyes are made out of straw, if they're thin, a little bit of pressure can cause a lot of damage. And so we have to go consider that. So you, as an eye doctor, you better measure that patient's corneal thickness to know if they're at greater risk.
I got you.
And so that's why, because just genetically, blacks tend to have thinner corneas, eyes, and then there's also this linking to inflammation.
Well, there's plenty of diseases. I've had plenty of doctors on here, and I'm always, if we're talking about a particular disease,
yes, every group
I always
has
ask, does it affect someone more than others?
So look at this. We were just talking off air about the COVID, okay? And the fact is, you don't hear one commercial, one politician talking about get healthy, quit eating the junk, lose the weight, quit smoking, kind of, if you will, air quotes, quit being diabetic and doing diabetic-y things, and because and so sleep, reduce your inflammation, and so if you have an inflamed leg for some reason, it's going to affect your eyes. It all circulates around, okay, and so if you got some funky smell in the other room, it's going to get in the air system, and you're going to smell it, and so it all gets around. So inflammation anywhere in the body is bad for all parts of the body, and so that's yet another rock that you put on the pile of rocks as to what's caused a problem, and it's inflammation.
Well, here's my concern, though, and I frequently go down this road. And by the way, between Dr. Wilson and the Civil War and you just talking in general about all the stuff you talk about, I've learned more about things I've never had a desire to learn about ever. So it's been amazing. But I often go down the road that if I come in just for a general eye exam,
yes,
should I expect you or whoever to be able to tell me, we need to look at some other stuff. You potentially have some glaucoma signs.
Good Lord, yes. And sadly, these things don't. I mean, most eye care providers are doing a great job and all this sort of stuff. But you have to be on. You have to look. You have to have the wisdom and the moxie and the compassion to sit here and put the pieces of the puzzle together. You also, the truth is, you have to have the technology to go look at these things. And so, in our office, our mission statement clearly states that we will always invest in good technology. And we have a laser that takes a quote picture of the back of your eye.
It's amazing. amazing.
And so we can see things in phenomenal detail. For someone to look in the back of your eye and not take a picture, I don't know how you can practice that way. Because when I take a picture of your face today, and I take a picture of your face in a year, I'm going to see the differences. Versus you go, yeah, you look about the same, and you can't see these subtle differences. A laser scanner to look at the different layers of the eye, and you can look at the microvasculature of the eye with this OCT. Visual field units that are perimeters and these microperimeters that can see eensy-weensy spider little changes in your visual field performance. Do you check how thick somebody's cornea is? And that's another tool you have to buy. And all this stuff is money, time, and
Exactly.
risk and expense.
Training.
And training and staff training. And
Well,
yes.
what question should a patient ask? Now, for example, I would venture to say I did it, Leah did it. When you said the thing about holding your thumbs up at arm's length, about 18 inches apart, I did it immediately. If I did that,
No.
and
I quit the Lions Club because of this, okay? I was a Lion for 15, 20 years, which is appropriate for an eye doctor to be, and I just had a professional problem with it. One, there was 30 meetings a month, but two, a year. And so, but the problem is truly, listen, the Lions are all about sight. I love the Lions. I donate to the Lions. But when you go, some people would go to the state fair every year to get their pressure checked. They go, yeah, my mom and dad went blind to glaucoma, and you said my pressures are okay, and you can't say that.
Wait a minute. Go to the state fair every year to get your pressure checked.
Listen, I'm not picking on the Lions. What I'm saying is,
Oh, they do it there.
They
Okay.
check your pressures in the Lions van, the pressure
Okay, I
screening.
gotcha. I've
And the
seen
thing
it.
is, you can be going blind from glaucoma with a quote good pressure because there's so many variables that you get involved with. I just had a professional moral conflict with that, saying I can't do this because I can't pat you in the back and say you're good to go and you may not be. And I knew too much. And so you need to, every couple years, go get a stinking eye exam. They're precious organs.
And do I ask you? Can you look at me for glaucoma?
I can't imagine an eye doctor not thinking about whether or not you have glaucoma. The way I do it, my practice and my brain, you're guilty of everything until I don't find it. And that's why I do it. I'm a negative approach, and then by the time you go, okay, well, everything's okay. Yesterday, a patient, end of the day, his pupils were two different sizes, and he's going to get a chest X-ray because he could have a lung tumor, and some other tumors in his chest which make his pupils different sizes. And the thing is, I've seen him.
The tumors are making that?
Yeah, there's wires that go from your brain out your cervical vertebrae across the top of your lung and up your internal carotid to your eye. And there's this.
I knew that.
Yeah, it's this crazy pathway. Like, why the good Lord put it together that way? It's like like some electrician getting paid for how many feet of wire they put in. And so this guy's going off because I paid attention. And I looked back in the chart, and 3 times in the past, his pupils weren't noted as asymmetrical. So we're going to see. You don't know. And so back to the glaucoma, I would like to think that my optometric and ophthalmological brethren are all in Sistren are always checking for those things. So you shouldn't have to ask, but it's always nice when you alert your doctor about, hey, that's why we ask about family history. People come in all day long, and they give us a family history. Mom and dad have this. I don't want to have what they have. And it alerts you to being more, just a bit more aware when looking at that. Because if you told me that everyone in your family had a weird eye finding, then I'm going to go look for that weird eye finding.
Well, look at Leah's
and kid.
family.
Yeah. But we take views from 10,000 feet, then you get to 5,000 feet, 100 feet, and then you really get in there as you need to, and you're running a practice. You got to keep moving.
By the way, little sidelight before I let you go. Remember I talked to you about how I was seeing that thing?
Oh yeah.
And I hadn't stopped by. I think I know what the problem was. My blood pressure was up.
Mm-hmm.
And I don't know why, but I take a blood pressure medication. I had run out of it.
There you go.
I didn't realize I had. And I called the doctor and I said, I think I'm missing a medicine. Mm-hmm. Something's not right in what I'm taking. And I went through the list and she went, pick it up today. and I got back on the system. Blood pressure's back to good, and I haven't been seeing it since.
And that's fantastic. And so we didn't talk much about the treatment of glaucoma, and maybe you can pick this up next time. But so basically, glaucoma.
You can treat it.
Oh, good Lord, yes. So what you do is you have to lower the pressure. So back to the analogy of me squeezing your neck, you have to take the pressure down, and then you have to, there's all these different ways of, quote, taking the plastic bag off your head. You have to increase circulation. So sometimes the increasing circulation and increasing what's called retinal perfusion, getting the blood in with good oxygen and getting the trash out that needs to get out. And you can do this with B vitamins and D and things that are natural ways of going about it. Not everything has to be at CVS and Rite Aid, but there's laser procedures, there's little stents, there's major surgery for an advanced glaucoma, and you want to be in front of it because the more inflamed and advanced the condition is, the harder it is to get the genie back in the bottle, and you usually have it for life. Some people they pass,
but it can be
they
controlled.
pass through a storm. Yes, controlled. And the biggest problem with glaucoma is it doesn't hurt, and therefore it's the one medicine you can pass up on. Oh, I'm okay.
Yeah.
It's like you and your blood pressure medicine. Okay, if you have it, you want to be properly diagnosed, properly managed, serially looked at, and we have an instrument that we use that we let people take home for a week, and they check their pressures throughout the night and the day. And some people's the thief of sight comes at 5 o'clock in the morning. So when they're checking the pressures, you see this spike, and you go, aha, that's when we gotta give you a medicine that's going to tamp that down. So there's a lot to it, and I have a great team. I couldn't do it without my team of people. And and we're looking for some help at the office. Somebody wants to. We're looking for some help, and everyone in the world is looking for help right now.
But the governor tells us our unemployment rate's 4.4%.
Yeah, because he's employing all of them to sit on their couch. And yeah.
Hey, hours at the Wilcox Eye Center.
Variable. We start anywhere from 8:30 and close 8:30 to 9, and we close from 6, 5, 6, 6, 4, and 3 on the weekdays.
Okay.
And